Good afternoon, everybody. This is Phil Gibson with People Care Health Services. I'd like to welcome everybody to our Community Connections talk today on special needs and navigating public schools. We have Christie McGovern with us today. She's a licensed speech language pathologist. I got to learn how to speak myself today. With 16 years of experience in pediatric hospitals, home health, private clinics, and public schools. Christie's been working in special education administration since 2008. She currently works for Aurora Public Schools as a special education consultant, overseeing the special education instruction and legal compliance in 7 of the district buildings, including 2 P-8 schools and 5 elementary schools. I'd like to welcome Christie, and thanks for joining us and giving us some additional information on how to develop relationships in the public schools.
Sure.
Thanks.
Thanks for having me.
You bet.
You can flip to the next slide.
Okay.
Wanted to start just with going through the outcomes and what we'll touch on, and a basic overall process on how to navigate special ed services in the public school, including annual IEP meetings and how to initiate the process if your student hasn't had special ed before. Talk about options through homebound services through schools, adaptive and assistive technology, and then parent and guardian rights when you have a child in special ed. The majority of this PowerPoint is going through an initial process if you haven't been in special ed before. But before I start that, I just wanted to touch on if you already have a child who has a 504 or an IEP, encouraging you at the beginning of the year to set up a meeting with the principal and special ed teacher or general ed teacher, and go through it, not necessarily to change anything, but just to make teachers aware of what's in the document, and then asking the questions on how they're going to be meeting your students' needs in the year. So first of all, if you have concerns about your child or a child that you know, how do you even start the processes? You'd start with an initial contact to the neighborhood school. And even if you're in a private school or home schooling, you still reach out to your neighborhood school, express a concern, request an evaluation. Putting a request in writing would be your best cover, so then you have some documentation that you've requested this and the date, and then the school is expected to get back to you within a reasonable time on how they're going to address that request. Once the request has been made by you, someone from the school should be contacting you to learn more about what your concern is, what areas, if it's cognitive or adaptive skills, which we call how are they able to independently go about what would be expected of them depending on their age. So dressing themselves, going to the bathroom by themselves, that kind of thing. Academic skills, is it reading, writing, or math? Communication includes language skills, both what they understand and how they're able to communicate verbally, as well as articulation. So that would cover students who have cleft palate, apraxia of speech, anything with the structure of the mouth as well. Motor includes fine motor, so how they're able to hold a pencil or write, or buttons. Can they do the buttons on their pants to make them independent to go to the bathroom, or can they zip their backpack? Making sure that they're able to do what's expected of other kids their age in school. Health would include vision and hearing, and if there's anything medically going on with the student. Social emotional can encompass behavior. It can encompass any current medical diagnoses, like OCD or bipolar, any of that's in under the social emotional. And then other includes transportation. It's mainly for older students. Are they able to get on a bus and go to school like other kids their age? Mobility is around vision. Do they need support with a cane or anything like that? And transition services for those kids ages 18 to 21 who are transitioning from school into the workforce. So someone from the school should be reaching out and getting an idea from you what your concerns are. There are a lot of times when a student is already in school and teachers might already have some concerns. So it's a time for you as a parent or guardian to sit down with the school staff and go through what's called the consent to evaluate. So you'd mark off the areas that you want or the school wants to do testing in, and then the parent or guardian would sign off that they approve in those areas, and then the evaluation would start.
Is there usually something that when this evaluation phase, is there usually something that triggers that for either the parent or the school, or how does that process start to kind of percolate, which would cause a parent to maybe say, hey, I need to look at this? Or
yeah, a lot of times it's parents that have had a concern, and as their child gets older, it becomes more evident that it's really impacting them. Sometimes it's a doctor. A doctor will recommend that they go to the school. Sometimes they'll write a prescription. That doesn't guarantee anything, but it kind of puts it on the forefront that it's a concern.
Okay.
In schools are required to provide intervention services to kids who aren't progressing like other kids their age. And so if they're already providing some interventions and then the parent comes and says, I have concerns, usually it's a mutual agreement.
Do you find sometimes schools are a little reluctant to kind of start going down this path, or do you find some schools are open to it and some aren't, or what's been your read on that?
It really, in my experience, it depends on the school and on the team, to be honest with you. I have some teams in my schools that are open and will jump into it, and some that are a little more resistant or want to follow a kind of a black and white process.
Sure.
When it's not a black and white process.
Yeah. Okay.
So I'd encourage parents to keep the principal in the loop, and if you need to, get the district involved.
Okay. That makes sense. All right.
So the school will have legally 60 calendar days to get the evaluation done from the time that they receive the parents' signed consent. They have 60 calendar days to get started on the formal assessments and then any observations or informal assessments that they want to do. At the end of the 60 days, there'll be an eligibility meeting. And this is the same process for a reevaluation too, as it is for an initial. So at that eligibility meeting, IDEA, which is the federal eligibility criteria, individuals with disability, there's 14 disability categories that a student could fall under. And so what's on the school team to determine and to gather a body of evidence for is based on the areas of concern and the areas of assessment, what disability categories are they going to consider? And then they need to build kind of a body of evidence. So when they get to the eligibility, they can either say, yes, the student meets criteria in the area of speech language, or no, they don't, and this is why. So the 14 areas, and you can find this on the CDE website under special education, traumatic brain injury, other health impairment, which includes it's pretty vague, but it does include ADHD, which is a big diagnosis right now. Mm-hmm. Orthopedic impairment, autism, developmental disability, which is for the younger kids when there's something going on, but you can't pinpoint it. Speech language, specific learning disability, deaf blind, intellectual disability, deaf with hearing impairment, visual impairment, emotional disability, and hearing impairment. And then there's multiple, which covers a couple of those.
Okay.
But just because a student has a medical diagnosis, like we talked about, that doctor writing the prescription, doesn't automatically translate into an eligibility for special ed. It's really looking at the educational impact of whatever's going on with the student.
Okay. Do you think are there sometimes kids getting lumped into the ADHD group that maybe it's like some things in the medical world it's misdiagnosed where they don't really belong in that, but they get because they may have behavioral issues in class that are related to something else, or what are you kind of seeing with that?
Mm-hmm. Yeah, we see a lot of kids whose parents will just say, I think they have ADHD, and there isn't the medical backing. And there isn't required to be a medical diagnosis of anything to go into this process. But yeah, we see a lot of, or kids who have been diagnosed with autism, but then we also think there might be something else impacting them. And so it's the school's responsibility to look into that and do a bunch of assessments and not just be looking at this is ADHD, but really kind of, we say casting a wide net, to really look at some of the behaviors and maybe it's caused by something else. We've even looked at, is the student hungry? And can we put some snacks during the day? And that helps sometimes. So it may not even be medical. Sometimes there's something just physical that can be met. So jumping back into the timeline. So from evaluation to the eligibility meeting, they have 60 calendar days. And then there needs to be an eligibility meeting held. If the student is eligible in one of these categories, then the team has 30 calendar days to develop an IEP. Typically, it's done at that eligibility meeting. So they'll determine eligibility and then go right into planning for how they're going to meet that student's needs. And the IEP or individual education plan includes goals in the areas that were found in need during that evaluation. It'll include services. So is that student going to be helped through special education or speech language services, occupational therapy or physical therapy? And again, this is just to access school. So that creates a lot of confusion for parents sometimes when they are seeing an issue or a problem that's affecting them, but it's not necessary to function in school. So the school team is really just looking at access to the curriculum and access to school. The IEP will also include any supports, accommodations. So does the student need extra time to take a test? Do they need to test alone and not with the rest of the class because they're distracted? Do they need the test read to them? In the classroom, there's sometimes a student might need to just move. So there's special seats that they can sit on, or like rubber bands that can be tied around their chair that they can just kick. So that's those accommodations. It'll go through state and district assessments, like extra time, or do they need to take an alternate assessment if they can't meet the state grade level criteria. And then consideration of special factors is, do they need a healthcare plan? If they're blind, do they need a vision plan, or if they have a hearing impairment, a communication plan, or transportation is included in that too. So they really look at everything that the student needs to access school.
IEP, for those that may not be familiar with that term, what's that stand for?
An individual education plan.
Okay.
Oh, can you go back one real quick?
Yeah.
So who should be at the IEP team meeting? There's required to be the student's general education teacher. For students who are more impacted and are in a separate class most of the time, that gen ed teacher could be an art teacher. A lot of times kids who have severe disabilities will go to a gen ed class for art or for music. So a gen ed teacher needs to be there. The special education teacher needs to be there. If it's a student who's just getting speech language, then that would be the speech pathologist. And any other related service providers who did any evaluations or who served the student. So OT, PT, speech, audiologist. And then someone who can speak to the district and school resources. So that might be the principal, it might be someone from district. Special ed teachers may not have someone there, but if there becomes an issue, they may kind of put the meeting on pause and be able to bring in someone who can allocate additional resources if needed.
Okay.
There are team excusals. So if the speech language pathologist isn't able to be there, then they should be contacting the parent or the guardian to make sure that that's okay. And then if the parent says no, then the team needs to relook at another date where everyone can be there. Okay. So that's really on the parent.
Okay.
Homebound services are for a real small minority, but just so you all have the information. Different districts are going to have different processes, but homebound services are really for those students who are too medically fragile to attend school. Sometimes it's during the flu season where they can come to school in the early fall, and then they need to go homebound from November to February, and then they can come back to school in the spring. And that's really the school team or the school nurse working with the doctor, the student's doctor, to say, is it safe for them? Is it healthy for them to come? That should be documented in the IEP with through the services, and then also in the service minutes, and then in the meeting minutes. So that should be a pretty clear communication between the school team and parents.
Okay.
Assistive technology is a big topic right now. There's so much more available than there was even just a couple years ago. It can be part of a special ed evaluation if a student has severe communication deficits or significant motor impact where writing is difficult for them, or even a academic disability like reading. So then there's software where a textbook can actually be uploaded and then read to the student. It can be set so it highlights the words as it's reading through, to really give the student access to both the visual, the print, as well as the auditory information, and then to take away, for students who need support with writing, it can really take away a huge frustration for kids if they can type, or there's some word prediction where they can just get the first couple letters and it'll give a kind of a bank of words. So I encourage that to be part of special ed evaluations if your student has a significant disability. It can also be an accommodation on a 504 plan, and we'll go into that more too. But it doesn't just have to be on an IEP. Your student, and most classrooms now will kind of make those accommodations for kids as needed. But if it's something your student absolutely needs, then I encourage you to get either at least a 504, request a 504 plan, or go through the special ed evaluation process.
I mean, based on some of the stuff you've indicated here, it looks like it doesn't appear to be that there's really any child, as long as they're, able to adapt to the day in the environment of a school, that it looks like there's enough technology and support there that virtually any student could go to school.
Absolutely.
Yeah.
Even the students that are on homebound services, we have it set up where they're Skyping into a classroom.
Okay.
So they're still part of that classroom community and that environment, and they're hearing instruction from the teacher. It just decreases that isolation, and then it's such a part of just functioning now that it's teaching them some of those life skills too.
Yeah, that's really neat.
Make sure I got everything on there. Yep, good. A 504 plan is different from an IEP in that an IEP has those specific criteria that we had talked about within each of those eligibility categories. That there has to be evidence, and you have to check the box and say yes or no and have the backing for it. With the Section 504, it's much broader, and it basically says, yes, there's a disability that impairs life functions, and that might be attention, it could be just basic life skills. ADHD is a common one under a 504. If it's affecting a student, but they're still able to learn and get the information. They just need some accommodations. It's also for a student, it could be short-term, say a student who broke a leg and is in a wheelchair and needs some different accommodations to get through the day. My daughter's on a 504 with some attention issues, and so we're helping her, and the school's helping her with organization and turning in homework, and so she's not getting marked off if something's a little bit late. We're really working together to hold her accountable, but also to give her a little slack in a way. But
sure.
So a lot of kids who will go through the IEP process may not meet the criteria, but there still may be an area where a student needs some support, and so a 504 is a great support plan for them.
Okay. Is the 504, is that fairly new, or has that been something that's been around for quite a while?
It's been around for quite a while.
Okay.
And it really, the big difference between the IEP and the 504 is that the IEP, a student needs specialized instruction.
Okay.
So most of the time it's academic instruction, they're just not learning as expected. A 504, a student doesn't need the specialized instruction, but just needs the accommodation. So maybe they can still learn, but they just need a book on tape, or we don't have tapes anymore, but
right. I understand.
An audio book or on the computer.
Right. Okay.
Does that make sense?
Yep, absolutely. Mm-hmm.
All right. So in this whole process, even if it's a 504, you still, parents have certain rights under the procedural safeguards, which gives a parent insurances, I guess, that the school team is not just going to do whatever, that the parent will be involved in that. So some of the parent rights are a school team cannot assess a student formally with standardized assessments that's different than what the rest of the class would be getting without written parent consent. They can't start an IEP, an initial IEP without parent consent. On a reeval, it kind of rolls over. If the student still needs it, and they can continue to provide that support, but not on initial. They can't start that and pull the student out of class or give them anything different. Parents have the right to refuse special education at any time. You can, if a school team comes to a parent and says, we have concerns, we want to evaluate in these areas, the parent has the right to say, no, I don't want that. Okay. If a student is receiving special education, the parent has the right at any time to go to the school and make a written request that your student not receive special education anymore, and the school will stop. For a student going through an evaluation, if the evaluation, the parents disagree with one part of the evaluation, I would have them contact the director of special ed, but they have the right to request an independent educational evaluation. And we'll be given kind of some options in the community where they can go get a private assessment in that area at the district expense. Okay. Parents can request records at any time, special ed or gen ed. What else? And then parents are required to be given prior written notice before anything changes in the IEP. So, or if the school district refuses to do something that the parent wants. So, okay. If the school is going to change something in the IEP, they need to hand the parent kind of prior written notice of this is what we're going to change, or this is what we're proposing in the IEP. Okay. Sometimes it's rare, but sometimes if a parent requests an evaluation and the district says no, they need to give the parent that piece of paper saying why they're refusing an evaluation. Okay. Or why they're refusing to offer a certain service to a parent or to a student.
What's your thoughts on, when these, maybe a parent starts seeing some stuff in a child, or from a learning perspective? One of the things I know with my son that I heard from some of the staff members at the school was particularly surrounding vision-related issues. You hear about dyslexia a lot and all that kind of stuff. Schools, a lot of times they'll have somebody come in and do an eye exam, but I've heard some of the folks like in your position or otherwise, they say, that really doesn't do anything. It tells you whether they can see close up or far. They really need what they call a vision exam, which really goes a little bit deeper. Do you see that in other parts of some of these assessments where they're kind of surface level, like the initial, maybe what's initially done is on the surface, and a parent really should maybe dig in deeper with additional testing and it may be on their own volition just to really uncover some things? Or what's your thoughts on that?
That can kind of get sticky.
Yeah.
It's the school's responsibility to dig in deep for a student to determine what they're going to need in school.
Yeah.
Schools don't diagnose, or they shouldn't, dyslexia as a disability. They may look at it and say there's a reading disability, but dyslexia does require some additional testing, including some of that vision piece that schools don't have. Right. They'll address the reading piece of it and some of the accommodations that can help. But it does get sticky, because if the school district recommends you as a parent to go get an additional evaluation, then the school district can be responsible for the payment of that evaluation. Okay. We do work a lot with doctors and communicating back and forth, and a lot of times a doctor will have a full eval, like at Children's Hospital, and then we'll get those results, or we'll be in communication with the team on this is what we found, and they may do some additional ones. Okay. But typically the school should be able to do a thorough enough evaluation to be able to provide that student access to their education. Yeah,
that makes sense. Now, if there is, I think this is another area where I think sometimes parents think that the school should pick up the cost on this, but are there some areas of the disability that, as a child grows, they may grow out of them, or they can I don't know if you want to call it this, but they can learn their way out of stuff, where they basically train themselves to, because I've seen, just in stuff that I've seen, you see kids adapt. They just adapt because of what they've got. Do you see that where sometimes, they may be in an IEP early, but then later, in their later school years, they're off of it? Or do you see them, if they start in elementary school, they're on it the whole way?
No, that's a good point. No, we try and get them off of an IEP. Okay. And so every 3 years, a full reevaluation is required by law. Okay. And so the school district does the full reeval in those areas of concern that they've been addressing, and then any additional ones. But no, we see as kids grow, they all change, and the developmental delay that I talked about earlier is for kids under 9 years old, where there's something going on, but you can't really pinpoint it. And then as they grow, by 9 years old, they need to have either a different disability that's more specific, or maybe they don't need an IEP anymore. Maybe they just need some of that early intervention, and then they're caught up. Okay. But yeah, we see it a lot where a student maybe meets criteria under the autism, and then as they grow and mature, some of that autism may stay, but maybe also we're seeing some attention pieces that's affecting them more. Okay. Does that make sense?
Yeah. No, that does. Absolutely.
But yeah, kids grow and change, and so the school should be ready. And if before that 3 years is up, if a school and a parent sees a significant change for the better or for the worse, then they need to look at doing a reevaluation to see what's going on. Okay. No, that makes sense. All right. Sorry, but no, you're good. Another thing that we see a lot too are kids that have had seizures, like constant seizures, and then they're on a medication or have a surgery that kind of helps that. Then we might be looking at a different disability or different supports that the kid needs.
So that brings up an interesting question. How does the school system, you bring up seizures. One of the big caveats for that right now is the, CBD or THC for these kids. It helps stabilize some of those seizures. Sometimes it even reduces them altogether. How's that working in the school system? If you got a kid that has, they're using that as a way to control their seizures, does the parent have to come to the school and administer that type of stuff?
That's a really good question. Yeah, I'd probably pass that through our lawyer and our director. Yeah, just curious. I haven't had that in any of my buildings yet. I do have some parents who give it to their student before they come to school. Okay. And then when they're back, I haven't had a request. Okay. Yeah, I didn't know if it was something that you can give it to them before. I would imagine that the parent would need to come and administer that. Yeah. Okay. But just curious. That would be a district lawyer question. Yeah. Absolutely. Okay. Yeah. We'll get them on next week. You want to go to the next one? Sure. Okay. Oops. Let's see here.
Oops. There we go.
These are just some of the resources that are helpful for parents. Child Find, I kind of skipped over that one. For parents who have younger kids below school age, the school district can still evaluate through the Child Find process. And so they can do the evaluation for a child who's a year and a half or 2 years old. And then that student would be able to start preschool when they turn 3. But hopefully get some services through community resources like developmental pathways. But this is a website that if you want to reach out to Child Find, it kind of lists throughout the state who that contact would be in each area. The next one is the Colorado School Districts and BOCES websites. And BOCES are in mountain districts, rural districts, where it's a very small school district, and so a couple districts come together to pool resources.
Okay.
And so that's listed there for parents who needed to reach out and kind of get a contact. The eligibility categories that I talked about are listed at that website, and it'll go through and you'll be able to see each question that the school and the parent would need to answer. And then the parent and guardian procedural safeguards. There's a copy there. And that one also covers if parents disagree with the school district or what's being offered as part of that free and appropriate public education. Then it kind of lists what they would do to go through mediation or to file a state complaint or to go through due process. Okay.
So have you seen, or have your counterparts in the various districts around the state, is it pretty consistent? Have you found it fairly consistent district by district around the state concerning, I know these criteria are probably consistent, but have you found the support is the same around the state, or are you hearing that, or is it reflective of, the wealthier districts, this is supported better than maybe a less less wealthier district?
From the rural, or not the rural, the metro districts, it's pretty similar. Okay. Most of Colorado is now on the same software for an IEP, so a lot of that's pretty similar. But the bigger districts do have access to more resources. Okay. Than some of the smaller ones.
In your experience, have you ever run across a situation where it's either been a developmental disability or maybe a physical disability where somebody hasn't qualified, for an IEP? You have?
Yeah. I mean, okay. I've seen students that have been diagnosed with autism from Children's Hospital, and we do an evaluation and look at it, and maybe there's some quirks, and some little things, but nothing that's meeting that criteria. Okay. And so we do talk to the parent, and maybe the student will qualify for speech language on some of the pragmatic piece, but that bigger autism criteria isn't met. Okay. And that can change in flex too, and but I mean that's probably the biggest one that I've seen, where parents come in from Children's Hospital or another evaluation and say, my kid qualified for autism, I want an IEP. Okay. And so that's really difficult to explain to parents of, yes, we see that, but we have to look at the educational impact, and here's how we can support your child even if they're not on an IEP. And that's a good spot for a 504, where maybe they need some support with peers, or some support, they need kind of more structure, and that would be covered under that 504. Okay. But the impact of autism isn't to the extent that they need a full IEP or meet the criteria. Okay.
The language of IEP and 504, is that fairly consistent across the United States, or it is?
That's federal. Yeah.
That's federal.
It should be consistent. Okay.
Yeah. Okay, that makes sense.
Yeah.
What do you see any? Is there any reluctance from a district standpoint? I mean, how many kids are probably on an IEP or a 504 within, you say, a large district like Aurora? I mean, do you have 2% of the kids in the district are on some
It
form
actually
of...
comes out closer to 8 to 10%.
Okay.
So for Aurora, we have about 40,000 kids and about 4,000
Okay.
are on IEPs.
Yeah.
So it varies. And sometimes the state will come in and kind of look at what we have. Even in disability, they'll be looking at student ethnic makeup under certain disabilities.
Sure.
And kind of bring our attention. So we really try to really look at just the body of evidence that we have.
What do you see any gaps in the in the as from a, say, a federal level or even a state level? Do you see gaps that you think exist in the current system that maybe future legislation could fulfill those requirements, or what's been your read on that?
Budgets right now
Yeah.
are getting slashed, and I know medically that's getting impacted too.
Okay.
But schools are certainly feeling it.
Okay.
With special ed, we're really getting cut hard.
Yeah.
And it's a population that just needs a lot of support.
Sure. Absolutely. Yeah. Awesome. Let's see. I'm going to open it up to questions to our attendees out there. So if anybody has a question, looks like we do have one here. So question, what is the best thing to do if you feel the school or school team doesn't seem to be willing or wanting to address your concerns?
I think I have some more questions for you, but I would request an IEP meeting.
Okay.
And have the administrator at that, and maybe even request someone from district to sit down and go through the IEP and hear out your concerns and have more of a conversation as to what's going on and then what can be done about it. But I would involve, if you're frustrated with the school team, I'd involve the administrator and then someone from special ed in the district. What's
the person at the district level? What's their title? Are they like the director of special education, or?
It changes. I mean, different districts call them different things.
Okay.
In Aurora, we're called consultants. I know in Denver, they're called directors, and there's several directors below the big special ed director.
Okay.
I'd call the special ed the main office number.
Okay.
And ask.
How do you know you as a parent aren't being unreasonable with your requests of a school and or a team?
I don't know that you ever totally know.
Okay.
You know your child the best. And so I don't think in advocating for your child that's unreasonable in any way.
Okay.
For parents that are struggling with teams or knowing kind of those questions that you have, there are advocates, educational advocates out there that know how schools work, a lot of times know the staff in the schools, and then know the law as well. And they can help you navigate and either push the school, or they can help you understand what the school is doing and how they might be meeting your concern, but it may look different than what you're thinking.
Do you think at times schools maybe, if say you have a very aggressive parent that's advocating for their child, rightfully, or maybe there isn't a situation there, but do you ever find where a school gets pushed into a corner where they just feel like they have no options? We're just going to have to, develop whatever plan we need to develop for this child because the parent is maybe obstinate and just doesn't want to take your advice, or, not you per se, but the team's advice on how to approach working with this child? Do you ever, do districts run into that from time to time?
Yeah.
Okay.
A lot of times.
Okay.
And if you as a parent are feeling that way or feeling like you're getting backed into a corner too, I would recommend that you reach out and get an advocate.
Okay.
Schools may, and I've been in that situation too, where we've done what we can and we're looking at the data and there's not seeing eye to eye, and the school may come up to a point where they're saying, no, this is our offer of FAPE. And that's when I'd encourage you to look to an advocate, or you do have your parent rights. If you feel that the school's not doing what they should be doing, then you start following that process of mediation and getting the state involved.
Yeah.
Hopefully it doesn't come to that. Hopefully you can get the director of special ed involved and come to some kind of agreement for both sides.
Sure. I think that it is a good point. The goal is, if possible, to get children off of IEPs. That should be celebrated. The goal is not to get them diagnosed with something so that they have an IEP, and I think you kind of referenced that.
Yeah.
And then the resource websites, we've got those on the screen right now. The Child Find Contact, and give us another explanation of that. That's for kids under a certain age again. Is that that first one on there?
Yeah, so if your child's already in school, preschool or kindergarten or up, I would contact that school and make your request. For kids who are younger, 2-ish, 2.5, Child Find is a team. So you would take your child to one of the district locations, and they would do an assessment there and determine, usually it's pretty quick, right? In that meeting, they would determine, is she eligible or not? If your student's 3, between the ages of kind of 3 and kindergarten, 3 and 5, they would be eligible to attend the local preschool, and they'd get their special ed services there. For younger kids, developmental pathways, at least here, developmental pathways is kind of our go-to that would provide some of that home therapy before their school age.
And then, just as a reminder, we've just put these out. If you open up your chat box, Devin has put each one of these links out there. You can do a quick copy and paste into a document, or go out on your Chrome or Explorer, and if you need to, go ahead and bookmark these. For those in the rural areas that are listening to us, the one website that Christine mentioned was Colorado District, and the BOCHI website, which includes a lot of those rural districts that might be teaming up to provide these resources in the rural parts of the state. So that's probably an important one for those of you that are listening in the rural environment. Let's see if we have any other questions. No, looks like that's about it.
All right.
Any other closing comments or anything you'd recommend for parents that are, maybe starting the process of, looking at this, or, maybe they think there might be an issue, and just kind of exploring what to do?
I'd meet with the school. Start with the principal.
Okay.
And just sit down and talk about the concerns. And then as you're going through this process, it's pretty technical language that's both in the parent procedural safeguards as well as what the team would use.
Okay.
And I encourage parents to stop the team when you're going through this process and ask for explanations. And don't feel embarrassed or bad. I try and read parents when I'm in these meetings with them in a team, and we'll stop and back up and kind of explain or see if they have questions. But I think don't be afraid to ask the questions.
Okay.
And to advocate for your child.
Great.
Yeah.
Hey, thanks a lot for coming in today and talking about this. I know it's a topic that anybody with kids, and if they're having any kind of challenges learning and everything, it's really important for them. So yeah. I appreciate your time.
Absolutely.
Everybody, thank you for joining us today. This will be the end of our Community Connection session. Our next session will be on September 13th. We look forward to having you all join us same time, 1 o'clock on Wednesday, September 13th. Everybody have a great rest of your day, and thanks again for attending.